The presenter of our main talk today is a member of our own community. Morgan is, she's got a lot of letters after her name. More to come, okay. Morgan has over 12 years of experience as a mental health service provider, working with children, adults, and families in hospital counseling centers and schools. Currently, she works in public schools as a licensed specialist in school psychology. Dr. Sowell will discuss her professional experience and research related to how an individual's religious or secular beliefs can help or hinder the treatment of mental illness, which sounds utterly fascinating. I'm not going to call you doctor anymore because when you're here, you're just one of us. So we can't. We have so many degrees around here, I can't keep track of them. So let's just welcome Morgan Sowell. Thank you.
Yeah, I've got a lot of letters after my name now, and I'm working on becoming a licensed psychologist. And in the state of Texas, though, I can't legally call myself a psychologist till I become a licensed psychologist. But I basically do all the same things they do, just technicalities. I want to say thank you to David for what he said today, and it does tie in really well with my topic. And my goal anytime I speak anywhere is to start breaking down the stigmas associated with mental illness and get the conversation rolling about it, because I guarantee everyone in here knows somebody with something. I wouldn't be a good mental health professional if I didn't give you a little bit of stats about mental health. At any given time, about 25% of U.S. adults are experiencing some form of a mental illness, and 50% of U.S. adults are expected to develop at least one mental illness in their lifetime. Major depression is a leading cause of disability in the U.S. for individuals 15 to 14 years of age. I work with children as young as 5 and 6 years old with serious mental illness issues. Major depression affects 14.8 million American adults, and anxiety affects about 40 million American adults. Those are our two biggest mental health disorders out there. Most adults with mental health symptoms and individuals without mental health symptoms agree that treatment can help persons with mental illness lead normal lives. The problem is there's a lot of stigma associated with taking a pill for a mental health issue or going to a mental health provider. I process that with my clients on a daily basis and their families. 57% of all adults believe that people are caring and sympathetic to persons with mental illness, but only 25% of individuals with a mental health condition believe that people are sympathetic. That's a discrepancy on kind of how someone with a mental health issue views it versus people that don't have it and how they think they're being perceived by those with mental health. In doing my research into the published research out there, I've never actually researched a specific topic myself as a researcher, but I found this quote very good, and I think you can add secular beliefs into it. Religion and spirituality are essential ingredients of many people's sense of meaning that alter what they see, experience, and think, underpinning their values and beliefs. As a mental health professional, I have to understand what somebody's cultural, religious, or non-religious beliefs are, and how that colors how they view others in the world and how they view those interactions. And it's a really critical part, but it's a very touchy subject. And I found people's willingness to discuss their religious or non-religious beliefs to be an even harder subject sometimes than admitting that they are having auditory and visual hallucinations. Given that we live in the conservative South. My first experience, though, I was a substance abuse counselor right out of undergrad and worked with probationers and parolees. So these were people that generally had some sort of offense related to drugs and were court mandated to be in treatment. And and that many of them struggled with the 12 steps, and that the 12 steps include God, higher power, prayer, meditation really heavily in them. I had many of my clients ask me, I understand that these 12 steps have helped a lot of people maintain sobriety, but I do not believe in God. That is not part of my belief system. How can I still work these steps that I know have been shown to help people lead a better life? I want to lead that better life, but how do I do that? And I ran groups of 5 to 25, mostly males. I was 22. And they had spent anywhere from a few days in jail to 16 years in prison. It was a sink or swim opportunity for me. But some of them were very religious and some of them were very secular. And we had very open and frank discussions in our group about this. And kind of what we came to is we kind of walked through these steps and looked at what is the goal of each step. You know, remove the concept of God or higher power out of it, but what is the goal? What's the essence of what that step is really intending you to do? And we kind of boiled it down to it's intending you to learn to reach out for help whenever you need it. And that if you believe in a higher power, that's one way to do it. But if you don't, who are the people in your life that you can reach out to whenever you need that help? And I no longer work in the substance abuse field, but friends of mine that do have been telling me that a lot more secular 12 steps have been developed, and this is an example of one of them. And I like that step 2, we believe that we must turn elsewhere for help. That was kind of the essence of what me and my clients boiled it down to. You need to be able to look outside of yourself and seek help and assistance. And this is what I face every day with each one of my clients, is who are those safe people they can reach out to, whether that is a God, also how do they view God, as a wrathful God or a God that is there to help them. But also, do they have people in their lives that they can trust with these things? It's a very personal process going through mental health. Research has shown, and my own personal experience as a clinician has shown, that being part of a religious community has a lot of protective factors. It's a source of support through life stressors, divorce, major illnesses, major floods like we experienced, regular contact with a supportive group in a safe and encouraging environment, place of acceptance and belonging, and promotion of positive lifestyles. Many religious groups encourage non-smoking, exercise, going to doctors, leading a positive, good life. In my opinion and my experience, though, you can remove that religion out of that and say just being part of a community like Houston Oasis. Several weeks ago, whenever we were experiencing the flood, several people from this group went out and helped individuals that their houses flooded. And it's finding that community for you. And that in and of itself is a protective factor against mental health issues, because you're around people that can notice, you seem to be stressed out. Is something going on? Do you need to talk? What's going on? How can I help you? Do you need a ride to go see the doctor? All of those things, it's really important. And you can find these things in non-religious areas, but whenever you have a more secular belief pattern, it's harder to find people that you're comfortable with sharing that with and feeling that you're accepted for all of you. Within the religious community, actually, houses of worship were some of the first places that people with mental illness received any form of treatment several hundred years ago. But the belief in demonic possession or sinful lifestyle and divine punishment still exist. And this one study in 2003 that was looking at Catholic patients that were being treated for depression. A lot of them believed that their mental illness had to do with demonic possession or influences. And I remember this story whenever it happened. In 2003, a young boy with autism was killed in an exorcism attempt. because his church believed that he was possessed by a demon. He was suffocated by the pastor laying on top of him while he was being restrained for 2 hours and whispering passages from the Bible and things to the devil to exorcise him. And the child's mother and other family members testified on behalf of the priest. A lot of people also believe that development of any kind of mental health issue is because you haven't lived a moral or spiritual life properly, and that you're weak, and that it's punishment and retribution from God. Whenever I've worked with individuals, both religious and secular, this same kind of concepts come up, though. With secular individuals, they do express that something's wrong with me. I wasn't right. I wasn't good enough, or it's not coming from God's punishing me, but they feel like I've done something wrong in my life to develop this mental illness or just these struggles. And the fact of the matter is, mental illness is a biochemistry thing. You're kind of born with it, and you kind of affect it through things that you take, and if you experiment with drugs and all that kind of stuff, or life stressors. It's going to happen. Whether you're good or bad or whatever, that's an opinion of people. And it's breaking down that stigma, and I spend a lot of sessions sometimes just breaking down that stigma before we're ever able to actually do the mental health therapy and work. And the stigma around mental health is one of the biggest obstacles I face. It is that you're having suicidal thoughts and you don't feel like you can reach out to anybody. It is that you're watching the TV and you kind of start going, are those people actually talking to me? What are they telling me to do? It is that you kind of feel like you change personalities and have these extreme thoughts and I've heard everything under the sun, I think, and I still every once in a while something new comes out of somebody's mouth, but I work with clients and teenagers that are going through the process that many of you have gone through in this room of being raised in religious homes and determining whether they want to abide by those religious tenets or move past them to a more atheist agnostic viewpoint, but they're also struggling with serious mental illness issues. I work with teenagers with schizophrenia, bipolar, depression, anxiety, suicidal tendencies, homicidal tendencies, all of those things. And my thing is to help keep them safe, be a source of support, help them communicate these thoughts to their families in a safe and supportive way. I've also had families tell me, I've had multiple families tell me that my son is gay or my daughter is lesbian. That's against our religion. We can't accept that. But you can't talk to them about being gay or lesbian in session. I'm like, well, no. We can talk about that if that's part of why the reason they're in my room. But because of those extreme religious beliefs, these children are developing extreme depression and anxiety and suicidal thoughts. But these families just can't seem to move past that and recognize that. While I've experienced with other families, they've been open and honest about this is against our religion, or even if they just have, the child has a mental health issue, it's against our religion, but they're able to sit there and process and accept their child for who they are at that moment and help them move past it. And it's like many of the talks I've heard, it's a continuum. Whether you're religious or not, there's a continuum there, and some are more willing to have their schemas and their doctrine challenged and reevaluate that process. As a clinician, though, I have a lot of ethical responsibilities in working with anybody I work with. And even if I'm out and about and not in my professional role, I am still bound by those ethical responsibilities in my profession. And I really liked reading this one article that they were researching about clinicians and how they evaluate religion aspects with their clients, because historically psychology has viewed religion as in and of itself kind of a mass delusion or a mental health condition. Freud believed that heavily, and he was the founding father of my profession. And even in the more modern forms of therapy, we are supposed to, as clinicians, kind of avoid the topic of religion, whether you have a belief system in a higher power or not. But there's also, in the last several years, been a huge push in our profession to be culturally understanding. And your belief systems in a higher power or not is part of your culture. It's what makes you who you are. And so it's important for me as a clinician, the first time I meet somebody, to try and get over maybe my own discomfort at times about asking, do you have religious beliefs? Do you find prayer appropriate? Even if you're not necessarily religious, are you into the concept of meditation and relaxation techniques? How do you view that? If you do have religious beliefs, what is your view on God? Do you view him as that wrathful, punishing person? Or do you have a positive attachment to that belief system where you find it to be a source of support and assistance? And in evaluating that, I want to use open-ended questions so that I'm not projecting my own viewpoints on to that client. I want to make anybody, no matter what their religious beliefs are, comfortable in my room to open up to me and talk to me. And I, myself as a clinician, and I know many clinicians that struggle with this, but it's something I found that I don't struggle with as much, is I learn the language that my client uses. And I have worked successfully with people of Catholic, Jewish, Islam. I have prayed with each of those cultures. And most of them have no idea what my own personal views are. Because that's not my responsibility. It's not my responsibility to convert them or change them in any way, shape, or form. Myself, I was raised in a home with a Catholic mother and an atheist father who are still married. And was raised that, it's okay. Any belief system is okay. That it's your own personal choice. And I found that whenever I am conscientious about that, my clients are much more willing to open up to me about these things and start talking to me about their own spiritual path and their struggles, especially now that I work heavily with teenagers. This comes up a lot in session, a whole lot. In my role in the school districts, I don't bring it up. But if it's something they need to talk about and it's going to help them ultimately do better and perform better in school and deal with their mental health concerns, I'm going to talk about it. I don't say there's nothing that's a no-go for us in session. Although I have had parents say, we don't like that you talk about it with them, but I sit down and talk with the parents about it and we process that. Another big challenge for any mental health professional whenever you're looking at the concept of religion is diagnosing a mental health condition within that belief system. Because I have worked with African American families and Hispanic families that within their kind of microculture, it was totally appropriate and actually very abnormal if you did not have these fits or episodes where you believed you were being visited by spirits. That would have been considered abnormal in their family. And actually in our Diagnostic and Statistical Manual, which is basically my work Bible, I get very friendly with that on a weekly basis. It actually discusses how we have to take a person's cultural and religious beliefs into consideration whenever diagnosing a mental health condition. And one example of this is with delusional disorders. Delusions are a characteristic of many disorders, but also can kind of be a diagnosis in and of itself. And the DSM says that delusions are fixed beliefs that are not amenable to change in light of conflicting evidence, Their content may include a variety of themes: persecutory, referential, somatic, religious, and grandiose. Delusions are deemed bizarre if they are clearly implausible and not understandable to same cultural peers and do not derive from ordinary life experiences. I have seen both psychologists and general people in the public use that first sentence, "the fixed beliefs are not amenable to change in light of conflicting evidence," to argue that religion is a delusion. I choose not to focus on that aspect. I choose to focus on what might appear delusional to me is people from their same culture, do they understand it? That helps me determine, is this truly an abnormal, interfering, debilitating issue for this person? And I was lucky enough to do a year-long practicum in our medical center here in Houston and got to work heavily with international populations and work with translators, which adds a whole nother level of challenge to understanding somebody. But I had to spend a lot of time understanding what their cultural beliefs were, because to me, how they were acting looked a little on the mental health issue side. It looked bizarre to me. And research has shown that clinicians are more likely to diagnose actually pretty severe mental health issues in populations that they don't understand the cultural belief systems, because to them it appears bizarre. Here in the US, Catholics are less likely to be diagnosed with more severe issues because it is the popular religious culture. But Jewish and individuals from the Islamic faith are actually more likely to be diagnosed, even if the vignettes, the stories that are presented are exactly the same. The only thing that changes is the religion. Because more clinicians are familiar with the belief systems of the Catholic faith than some of the other major religions. And also the stigma around, especially the Islamic faith of late, due to the social political aspects going on. And in my training in school, we were taught heavily, we have to be able to look at ourselves before I can properly diagnose somebody and not project my own things onto it. And so in my own spiritual path, I started that off as a teenager whenever I decided not to confirm in the Catholic Church. It shook up my family. But as an adult, I've had to go through this over and over again, even with each client and each new individual that brings it up to me, so that I know where I stand, so that I can better help them identify where they're truly standing and where they want to go on their treatment for mental health. Because treatment does help. Early treatment helps. And it's removing the stigma that is either coming from a religious, spiritual belief system or just the general cultural beliefs about mental health. And that's one reason I love working with teenagers, because they're starting to get on that path and realize I need to do things differently than what my family's been doing. And helping them create those first few bricks in that new path that they want to create for themselves and their future lives. And it's so much fun to me. But the big takeaways I want you to have from my talk today, and this is such a big topic that trying to condense it down into 25-30 minutes was a challenge. Because I could babble on for this in probably a college level course. But religious and spiritual and secular belief systems can help and hinder identification and treatment of individuals with mental illness. Ultimately it's an individual thing, and all of us in this room have different viewpoints on it, and that's okay. But it's recognizing that there are resources and there is help out there, and as David said, you can actually go into any ER and say, I need a mental health evaluation. Doesn't matter what ER. They're state mandated to evaluate that. Belief systems impact how an individual's behaviors should be viewed, and if they are pathology of mental illness. We really have to take that into consideration. And no matter the belief system, people are people and have a high likelihood of developing mental illness. We're all going to experience life stressors. I've had a life stressor where I had a bout of depression, but I sought out assistance and treatment whenever I needed it, and have been good to go ever since. But, you know, that was something, though, I knew that I needed it, and I didn't let it get beyond where I couldn't control it. And through that own personal experience, I think it's made me a good mental health provider, and even growing up watching family members struggle with various mental illnesses, and various family members that are devout religious and think prayer can just solve it. And whenever working with families, I have called Child Protective Services and Adult Protective Services whenever families refuse to get the kind of treatment that somebody needed, because they just thought, if we just pray enough, it's going to be okay. That is considered a form of neglect. Within your own family and cultural beliefs, break the silence and stigma associated with mental illness. Be willing to talk about struggles you may have or struggles you have seen others have, you know, and keeping things confidential between friends. But being willing to have the conversations with people is so important in this process. And, you know, I just hope that my talk today got some wheels turning. And I'll be at lunch, but that's it.